Welcome back, everybody. Here we are. This is Dr. Jenkins. Here we are to finish up our chapter on the tissues. In the first video of this chapter, we introduced tissues and then we talked about epithelial tissue and we started our discussion of connective tissue. We ended on dense regular and dense irregular connective tissues. So let's just jump right in. We're going to pick up where we left off, and that is talking about connective tissue. The next three connective tissues are all types of cartilage. So in our body, there are three possible types of cartilage: hyaline, elastic, and fibrocartilage. Okay, so let's first talk about what characteristics these cartilage tissues have. You know, what makes sense to me when I look at the slides of cartilage, no matter if it's hyaline, elastic, or fibrocartilage, when I look at it, when I look at the cells, to me, they look like eyeballs. Bear with me here. Eyeballs in the sense that they're two-toned. So in this particular picture, it's like little beady eyeballs, where most of the cell is white, except for a little dark nucleus. Other times, it can be a big eyeball. Here's the case: we have a really big eyeball-shaped cell, and then here, the center, or the nucleus, stains white. Or here, this looks like maybe a real eyeball looks, where we have the eyeball shape, and then the whiter part is on the outside, like our own eye, cornea, and then the inside is colored. I'm just sharing with you anything I can to try and help you with these characteristics. So if we start with that, okay? All the cartilage types have eyeball cells. Before I go on, let me go back to some of the other tissues, because I want to show you for comparison. In the other tissue types, the cells tend to stain as all dark. It's not two-toned. Look at these cells here, all dark. All dark. So other tissues, the cells with the nuclei will stain as all dark. So hopefully that helps you with the compare and contrast. Okay, so if we can identify that it's a cartilage because the cells look like eyeballs, they're two-toned, then how do we tell the three types of cartilage apart? So let's start with hyaline cartilage. Hyaline cartilage has the eyeball cells and a smooth background. Hyaline cartilage has eyeball cells with a smooth background. You can pick a location. This is found in a lot of places in the body. Connects ribs to sternum, trachea. You pick a location. And even though for some reason it got I think it's supposed to be underlined, I'm just going to pick a really easy function of support. We probably know already, cartilage tends to be flexible. So it allows for some movement, but at the same time provides some support. That is hyaline cartilage. If we look at elastic cartilage, it has eyeball cells, but it also has thin fibers in the back. Kind of looks like a spider web. So whereas the hyaline cartilage had the eyeball cells and a smooth background, the elastic cartilage has the eyeball cells with thin elastic fibers in the background. We find this easiest answer would be in our ear, and the function is to maintain shape. Lastly, we have fibrocartilage, as the name suggests. This has a lot of fibers. So fibrocartilage has thin little beady eyeballs with thick pieces of cartilage. This is a type of cartilage we find in the intervertebral discs of our back. If you didn't want to say intervertebral discs, you could also just say discs of back. And its function is shock absorption. discs of back, intervertebral discs, and shock absorption. There's some extra information here. I'm going to skip it now, just in the interest of time. But let's just continue with the last two types of connective tissue, bone and blood. And folks, these look really unique. I'm hoping nobody has a hard time identifying what bone looks like. This is compact bone. It looks like the cross-section of a tree trunk, these concentric circles. We know where it is. Well, it's in bone. And we know what it does. Gives support, stores minerals, you pick. And then, likewise, I'm hoping nobody will miss blood. It looks very unique. We know where it's found. In the blood vessels, we know what it does. Transports. So, I just want to end the connective tissue by talking about vascularity. Connective tissues can look very different, and also the blood supply within connective tissues can vary widely. Some connective tissues have a very good blood supply. Other connective tissues have a very poor blood supply. And this is unlike, for example, epithelial tissue. Epithelial tissue, by and large, has a really good blood supply. It gets it from the connective tissue underneath, but it still has access to a good blood supply, but not always the case for connective tissue. I would like you to be able to identify some types of connective tissue that have a really good blood supply, obviously blood, but you might be surprised bone. And we're going to talk about this in a couple chapters from now. Bone has blood vessels coursing through it everywhere. So it's got a great blood supply. On the other end, cartilage. Cartilage has a very poor blood supply. And it's kind of give and take. The reason why cartilage can be so helpful to us and so strong sometimes is because it is made up of a lot of fibers, which gives us a lot of support and strength, but it leaves less room for vascularity. Dense regular, which are tendons and ligaments, also don't have a very good blood supply. But as long as you can identify bone as having a very good blood supply, cartilage as having a very poor blood supply. And of course, this links us to its ability to heal. Because bone has a very good blood supply, often it heals very well. Not always, but often. Cartilage has a very poor blood supply, so almost always it doesn't heal very well. You'll have to forgive my thumbs up and thumbs down. I am an Orioles fan, being a native of Maryland, which means I'm a Yankee hater. Just having a little fun with you all. Oh, this is a fun thing I like to do. Okay, so let's say we have this situation. We have a digit avulsion. I found this online, and I gotta say, the picture actually looks pretty real to me. So in terms of, legitimacy, I think it's a real picture. The story that I found online with this picture is that somebody was climbing over a fence, and as they reached the top, they grabbed onto the top, and then they kind of jumped over to the other side, ready to jump back down on the other side, but then their hand had a ring that got caught on the top of the fence. So as their body weight went back down, the ring got stuck and their hand also got stuck, and it peeled off this skin here. So I picked this up because I want to know what types of tissue were injured. And I'm talking about the four main categories: epithelial, connective, muscle, nervous. And I'm going to pause for dramatic effect. Well, if we think about it, epithelial is the epidermis of the skin, so of course that was involved. I mean, it looks like it's down to the bone there, so bone is connective tissue, so we can check off that being involved too. And it's not just the bone. There's connective tissue underneath the There's connective tissue that makes up the underlayer of the skin. There's probably a little bit of adipose that was also involved. Is there muscle tissue that was damaged? Yeah, if we're to the bone, then we've gotten through the muscle. And do you think that nervous tissue was damaged? Are there nerve endings going throughout all of our skin? Why, yes. So, an injury like this would damage all 4 types of tissue. Now, this picture looks fake, I'll admit. This is a continued story from the website. This looks like it is plastic, but ha ha ha. Okay, so nervous tissue. We've talked about epithelial tissue. We've talked about connective tissue. Let's talk about nervous tissue. And I'm hoping, again, this is one that when you see, it looks unlike anything else. Nervous tissue has these neurons, and the neurons have kind of a kite-shaped body. And then they each have a long extension. This is nervous tissue. You know where you find it, brain, spinal cord. You know what it does, sends nerve impulses or communication. Lastly, so of the 4 categories, we did epithelial, we did connective, we just did nervous, and the last category of tissue types is muscle. There are 3 types of muscle tissue: skeletal muscle, cardiac muscle, and smooth muscle. Let's talk about it. These tend to look very distinct. Let's take a look first at skeletal muscle tissue. It is very dense. If you look, hopefully you can see, maybe I'll switch over to white for a moment. Can you see these vertical striations? They run all the way down, but it almost looks like the tissue is striped, like zebra striped, or some people say it looks kind of ribbed. We call those striations. So skeletal muscle tissue has these striations. It's very dense. Those are the 2 things I would use to describe this tissue. Very dense and has striations. The function is voluntary movement. This is the only type of muscle tissue that is controlled on a voluntary basis. And its location, well, these are the muscles that you think of, but let's be a little more specific. These are the muscles that are attached to bone. And, as it would be, that's why they're called skeletal muscles, because the muscle belly is here, but at either end is a tendon. And where do those tendons attach? Bone. Muscles attached to bone. Voluntary movement. Cardiac muscle is also striated, a little bit less dense. Right? Skeletal muscle, really, really super dense. Cardiac muscle tissue is a little bit less dense, although it's still striated. Additionally, a unique feature of cardiac muscle tissue is that every so often there's a darker band. These are called intercalated discs, and we're going to talk about them later this semester, actually. You don't need to know the name, but it's a characteristic that will help you identify cardiac muscle tissue. Less dense, striated, and every so often there's a darker band. Where do we find it? In the heart. And of course, it propels blood into the body, pumps blood out to the body. This is involuntarily controlled. Lastly, we have smooth muscle. And this gets its name because it is not striated. Skeletal and cardiac muscle tissue are striated, but smooth is not. It's very dense, smooth lines here, right? Very smooth lines, but there's no vertical striations. We find smooth muscle in the walls of our organs. Another easy place to think about is the GI tract. We find it in the walls of the GI tract. And this does propulsion. It pushes things. We think about peristalsis in the GI tract. The smooth muscle in the GI tract wall contracts to push things down our GI tract. I do always laugh because in this particular slide, if you read the function, maybe you already have, propel substances or objects, parentheses, foodstuffs, urine, a baby. Because indeed, this is a type of muscle that's found in the uterine wall that will contract during childbirth to push a baby out. But I just think it's kind of funny how it's written there. Okay. The end of this chapter here, we're not really going to talk a whole lot about things. There's a lot that we're going to skip. You don't need to know these injuries to tissue. What I want to talk about, and excuse me once again, excuse me, pardon me. All right, what I want to talk about here is we have special names for certain membranes in the body. We have these certain names for membranes in the body. So hopefully you can stick with me here and I can just tell you exactly what you need to know. So we're talking about the way that we classify membranes in the body. Excuse me. Membranes tend to line cavities or line places in the body. I think it'll make more sense as we go along. We're going to talk about what makes a cutaneous membrane, what makes a mucous membrane, and what makes a serous membrane. Okay, before we talk about each, you can see here coverings and membranes often incorporate more than one type of tissue. Well, let's just be really specific. These membranes, all three of them, as is the case pretty much everywhere in our body, but these membranes will be made up of epithelial tissue. And then remember, what type of tissue is always found underneath epithelial tissue? Connective. So as we go talk about these types of membranes, by and large, each of these membranes is made up of epithelial and connective tissue. That's all you need to know about that. Cutaneous membrane. A cutaneous membrane is an example of the skin. When you think of the word cutaneous, you probably think of skin, the ability to have sensations and feel touch. So if you ever hear the word cutaneous membrane, it's referring to the skin. And what is it made up of? Epithelial tissue and connective tissue. You don't need to know these types right now because you already know them. We know the epidermis is made up of stratified squamous, and the dermis is made up of dense, irregular connective tissue. Excuse me. Then we have something that we can classify as a mucous membrane. What makes a mucous membrane is that it lines a body cavity open to the exterior. It is often indirectly open to the exterior. Think of your respiratory tract and digestive tract. These are two examples. The picture here is showing the mucous membrane lining your respiratory tract. So lining the respiratory tract the whole way down is what we classify as a mucous membrane. It's a layer of epithelial and connective tissue that's indirectly open to the exterior. Even though we're down here in the lungs and it's not directly open to the exterior, when we breathe in air, that air from the outside is going down there. So it's indirectly open to the exterior. Lastly, we have a serous membrane. And I apologize in advance for using this word. Some people don't like it, but it's the best way to describe. A serous membrane is a moist membrane. We're going to be talking about a lot of these as we go through the body systems. When we think about when we think about the covering over the heart, the covering over the lungs, they are serous membranes. They're moist. And what is the benefit of these, the tissues lining your heart and lining your lungs? What's the benefit of it being a little moist? Well, to reduce friction. Aren't these areas that have a little bit of movement? Well, absolutely. Your heart fills with blood and then pumps it out. So as it fills with blood, it gets a little bigger. As it pumps it out, it gets a little smaller. Your lungs, when you inhale, your lungs get bigger, filled with air, and then when you exhale, the lungs get smaller. So when we have movement, it's necessary to have moisture there to reduce friction. Okay. This last slide here is just FYI. It would not be on an exam, but because we're talking about tissues, if you're interested, if you've heard of a sarcoma or a carcinoma, you're probably familiar that these are words associated with cancer. But more specifically, a carcinoma is some type of cancer of epithelial tissue. It could be the epithelial tissue lining a gland, the epithelial tissue lining lungs, whatever. And a sarcoma is a cancer involving connective tissue, much rarer, but these are named based on the tissue types they affect. But not going to be on a test. All right, folks, that is the end of our lecture on the tissues. I will see you for the next time.